Hi, I'm Dr. Ari Garfinkel, owner of the Smile Garden. I've been practicing dentistry for 9 years, and now it's finally time for my own space. I am so excited to be here. I really wanted to create a dental office that felt calming and relaxing when you walk in, not so sterile feeling. And I really feel like we've done that so much with the design and also just create a space that patients feel comfortable talking about their anxieties, their concerns, their fears, and really talking through different options with them so that people know all of the options they have when walking through their dental treatment needs. So, when patients are missing a lot of teeth, we often talk about treatment planning dentures for them, whether that be a full denture if they're missing all the teeth, or partial dentures if it's just replacing a few teeth. And we've usually talked about some other options for them. If implants are not an option or bridges are not an option, then we talk about a removable option. Dentures are something that comes in and out of the mouth. And so making sure people understand that they do need to come out at night and do need to be cared for, but we want to make sure that they look really nice, they look natural, they feel comfortable. Unfortunately, with dentures, they don't always give you quite as much chewing strength as with a permanent option like an implant or a bridge, but they are a great option to replace many teeth at once and usually for a lower cost. Someone comes into the Smile Garden and is looking to replace multiple teeth. And we've talked about how either they're not a candidate or don't want to do something that's fixed or permanent, like an implant or a bridge. Then we shift to talking about doing dentures, either full dentures if we're replacing all of the teeth, or partials if we're just replacing some of the teeth. And we talk about different design opportunities and we talk about different materials that we could use so that we make sure they get the look and the feel that is right for them and their needs. So, when we're talking about dentures, we have to be mindful that dentures come in and out of the mouth. They are a removable option. They can be anchored in with implants if we choose to go that route, but they don't have to be. If we choose to use implants also to hold those dentures in, then we do get more chewing strength than if we were not using implants. And so we need to also talk about those options with people. If they are going to get dentures, can they also get implants that'll really help hold those dentures in better so that we get much more chewing strength and feels much more natural, like their natural teeth were. So, oftentimes, when we are working with a patient to get them a really nice, natural looking denture, we want to make sure that we do the denture, create the denture in several steps. So, we have the patient come back for several appointments so we can make sure that the bite feels good. Then we make sure that the teeth are the right shape and the right size. And then we make sure that once that denture has been delivered, that we smooth out everything and make sure it's really nice and smooth with the gums and makes sure that the lip is supported really nicely, that it doesn't stick out too much, that it doesn't make their teeth look too big or too flat. And so we really make sure that we're taking all these steps that to make sure that the denture looks really natural with their face and looks as close to their original natural teeth as possible. So I love doing dentures, and I had a patient that had these big, bulky dentures for a really long time, and she just hated how they made her face look. She felt like her lips stuck out too much, that her chewing wasn't so great with them. And so, what we ended up doing is we ended up making her a new set of dentures, and we went through all the steps to make sure that her lip didn't look too bulky, that it looked natural with her face. We picked a smaller tooth shape and size, something that was a little brighter. So she felt younger and looked more natural with her face, and she just loved how it looked. When a person hasn't had teeth for a long time, it can be really hard to chew food effectively and to get the nutrition that your body needs. And so when we have dentures, when we make a person dentures, we make sure that their chewing ability is better, that they're able to eat more food and get the nutrition that their body needs. They're also able to feel more confident knowing that they have teeth now when they smile and they talk. And so going out in public can feel more comfortable and can allow people to have more fun out in the world. When a person decides that they are ready for dentures, we often need to talk about how the chewing ability is not quite as strong as their natural teeth. And so patients do need to be aware that dentures do come in and out of the mouth, that food can get stuck around the dentures, and that cleaning them and taking them out at night is a part of the home care. And to be aware that they do look really great and they help with chewing, but that there are some life changes that need to happen when you do have dentures, and we'll make sure to go over those. So when a person is finally ready to take that next step towards dentures, we definitely want to talk about what their ideal smile looks like. I actually had a woman that had a space between her front teeth, and so she wanted to make sure she had a space in her dentures. And we totally delivered that to her, and she felt so good knowing that her dentures looked like her natural teeth. So if someone is ready to talk about dentures and what those options look like, I would encourage them to call and schedule a new patient exam so we can take x-rays, see if there's any teeth left. Maybe we need to take some teeth out, see how the bone is doing, and we can talk about what their ideal smile would look like and how we can replace the teeth that they're missing with dentures, and talk about what their options are and what materials we want to use and just the overall look and shape that a denture could be.